Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 052. A 24-year-old pregnant woman on her 37th week of pregnancy has been brought to the maternity obstetric service with complaints of weak fetal movements. Fetal heartbeats are 95 per minute. On vaginal examination, the uterine cervix is tilted backwards, 2 cm long. External orifice allows inserting a fingertip. Biophysical profile of the fetus equals 4 points. What tactics of pregnancy management should be chosen? A. Urgent delivery via a cesarean section. B. Treatment of placental dysfunction and repeated analysis of the fetal biophysical profile on the next day. C. Urgent preparation of the uterine cervix for delivery. D. Treatment of fetal distress. If ineffective, then elective cesarean section on the next day. E. Doppler measurement of blood velocity in the umbilical artery. A normal fetal heart rate is 110 to 160 bpm. Fetal bradyarrhythmia is generally defined as a sustained heart rate less than 110 beats per minute. In severe cases, it can be life-threatening, putting the fetus at risk of non-immune hydrops, excess fluid in multiple areas of the body, and heart failure. Generally, the slower the fetal heart rate, and the earlier it occurs in pregnancy, the worse the outcome for the fetus. Fetal bradycardia can indicate fetal distress and an urgent need to deliver the baby to avoid fetal loss. Especially if it is sinus bradycardia in intrapartum, urgent delivery may be indicated. Biophysical profile is a test used to evaluate the well-being of the fetus by ultrasound and cardiotocography, electronic fetal heart rate monitoring. There are 5 components measured during the biophysical examination. A score of 2 points is given for each component that meets the criteria. The test is continued until all criteria are met or 30 minutes have elapsed. Interpretation of the total score: 10 or 8 with normal fluid, normal. Less than 8, fetus may not be receiving enough oxygen. 6, equivocal. 4 or less, abnormal. Fetal distress often requires birth by cesarean section. While this is a safe operation, it carries extra risks to both the mother and baby, including blood loss, infections, and possible birth injuries. The answer is A. Urgent delivery via a cesarean section.